Hi, and welcome to the show. Subscribe at kevinmd.com/podcast and get CME for this episode by clicking on the CME link in the show notes. Today we welcome Roshni Patel. She's an obstetrician-gynecologist, and today's KevinMD article is 8 Things I Learned in My First Year as an Attending. Roshni, welcome to the show.
Hi, good morning. Thank you for having me.
So let's start by briefly sharing your story and journey.
Sure. I grew up in New Jersey. I was born and raised here. I did my training here, and I come from a family of physicians.
Mhm.
No OBGYNs though, and I was attracted to the specialty of obstetrics and gynecology pretty early on. I thought it was an interesting place where clinical medicine kind of combined with advocacy for patients, and that's kind of how I got started.
Perfect. And how are you enjoying your career as an obstetrician gynecologist? What are some of the rewards and challenges of the specialty today?
So the rewards are, they range from small and little, little
Yeah.
victories of helping your patients just in the short appointments, explaining to them what's going on with their bodies, explaining medical conditions, and having your patients walk out with a sense of reassurance. And then there's some really great victories being involved in patients' lives, when they want to welcome a child,
Mhm.
and those memories are really enriching.
All right. So we're going to talk about your experiences as a relatively new attending. Your Kevin MD article talks about that. 8 things I learned in my first year as an attending. Now, for those who didn't get a chance to read that article, tell us what it's about.
Sure. So at the point that I wrote, it was a couple years back, I had been at two different positions, one a more classic private practice model, and the other sort of a more corporate model. And in both instances, it was a pretty steep learning curve, almost like a crash course experience.
Mhm.
And so I was inspired to write this article sort of as a primer of, sharing what I wish I had known, what might have made it smoother, and some of the I highlighted some examples of things that, not unique to OBGYN, but other specialties as well, of when you're kind of getting acclimated to a new
Mhm.
environment and what you can look out for.
Obstetrician gynecology residency has a reputation of being pretty demanding. So, what would you say are some of the biggest surprises that you experienced making that jump from residency to being an attending?
Sure. So some of the surprises or some of the things that were new were, the time spent counseling patients, specifically obstetric patients, about prenatal care. That's not something we did a lot of as residents. Usually in residency, you're jumping between labor and delivery and GYN and the ER. So the opportunity to like sit down and have
Mhm.
a conversation with the patient was a little bit new, a little different, and surprising in a positive way. Also, the sort of independence,
Mhm.
and I kind of talk about this, attendinghood is a little bit lonely. So you're independent, but you're also alone a lot. In residency, you're on a team. You're covering a group of patients with other residents. As an attending, you kind of have your panel of patients, and on your call day, you do your deliveries, and it's a little separate in that way.
All right. So you mentioned that there were things that you wish you had known that you know now. Share some of the wisdom that you know now that you want to share with these early career physicians.
Sure. So I think one of the big things is transparency. And that's not just between yourself and the employer, but between, yourself and your own aspirations. We jump out of residency sometimes not fully prepared for what attending life could entail. You might have to move across the country. You might have, a large extended family, children. How do we juggle and manage all of the, responsibilities that we have? So really knowing what you're trying to accomplish and, whatever job you're taking on, and transparency with your employer as well, being open to having the discussion of what your professional goals are, how you're trying to manage your professional contributions with your lifestyle. Those conversations, I think, are more helpful early in the game than later.
All right. So give us an example or a scenario or story where you had to apply some of those things in action. What would be an example of that?
Sure. So, one of the examples that comes to mind, I have two small children, And the juggling between childcare and office hours, sometimes you need to get out at a certain time to make
Mhm.
sure you're at home for your
Yeah.
children or to pick them up or that kind of thing. And I don't think that's a unique issue, but there are days where I would know that I need to work late, and then there's days where I need to leave at a certain time. So getting ahead of that rather than being frustrated or trying to finish faster than you can, that's not a really enjoyable
Sure.
experience. So kind of that planning ahead and that open and honest conversation. I can do some late days and I can't do all late days.
So, how was that conversation with your colleagues or with your office manager? Let's say there was a time where you had to leave early and you mentioned that you had to get ahead of that. And rather than that coming up to you, what were those conversations like?
Sure. So I approached it from the standpoint of I would like to honor all my obligations and to my children, my family, and my patients. So I said, these are the days where I can stay late or I can take a longer patient case list or what have you. And these are the days where I can start earlier so I can leave earlier. So it's a little bit of applying the art of compromise and figuring out what your boundaries are.
And did you find that your workplace was receptive whenever you brought that up, whenever you had commitments outside of clinical medicine, like to your family?
Sure. So I've had a chance to explore some different job opportunities, and some were more welcoming to have that discussion than others. And that's another, point I want to share for those recently out of training. If you're in an environment where your employer, office manager is open and receptive to having that conversation, that's a great thing. If you're in an environment where they're putting off that conversation, they're delaying it, or they're not really seeing eye to eye, that could be a red flag that there's other things that maybe you're just not speaking the same language about.
So, when you're looking for positions, perhaps during the interview process, are there any questions that you could ask or any clues that you could pick up to see whether that position is more amenable to commitments outside of medicine?
Sure. I think an important question that all of us can ask is, what's your onboarding process? Because there's lots of little nuances that when you join a new hospital system, like where's the OR and how do I change my scrubs? And we kind of think of these as little things, but they can really impact the quality and flow of your day, especially when you're in a specialty that has emergencies. So if they have an onboarding process rather that is reasonable, detailed, has some flexibility built into it, has some room for questions, then there's great opportunity there. They sort of throw their hands up and they're like in the air and they're like, well, this is what it is. That might not work for some people.
All right. One of the other issues that you brought up in your piece was the feeling of isolation and loneliness, right? Because during residency, you have that camaraderie, of course, in an academic or community medical center, and all of a sudden you're thrown by yourself, more or less, into an attending role. So, talk about that transition and talk a little bit more about that feeling sometimes of isolation and loneliness.
Sure. So different people may, pick up on this in different ways. I like being around people, so that stark contrast from having the camaraderie of residency to kind of being on your own as an attending was a little bit more jarring for someone like me. So then you work around it. You make time to, meet with your mentor in the practice or create a mentorship in the practice and say, oh, take that step of approaching someone and say, hey, what's working for you? What's not working for you? Can we sit down and grab lunch one day? Small gestures like that. And then I think it's also really valuable to stay in touch with your residency colleagues. I'm in touch with some of mine. They're very close friends, and we chat about interesting cases and how we, juggle the various responsibilities we have in our own lives. And I think there's opportunity for growth there.
So you mentioned that you've worked in several different environments as an relatively early career physician. So talk about the different environments that you've practiced in.
I've had a chance to work in the classic private practice model, where you're in the office, and that's where you're kind of more on your own. You see your patients when you see your patients. There isn't a lot of physician overlap unless you go ahead and make that effort to communicate with your colleagues. in this sort of more corporate model, there is a little bit more of a disconnect because that room for individual flexibility or office-based flexibility isn't really there. So you have to be a little bit creative about finding that sense of, camaraderie and teamwork.
So a lot of young physicians are going into that corporate model. And as you know, private practices are becoming less and less prevalent today. So when balancing commitments outside the hospital, work life balance, family commitments, do you find that a little bit more challenging in a more corporate environment?
It can be because the corporate environment sort of has this umbrella framework that we all have to follow, a set number of days off, set number of days
Mhm.
for CME and what have you. But there might be room in your day to day to have that flexibility, creating an office schedule where you sort of have templates. So you get, your quicker visits at the end of the day. So you're not, spending all the time at the end of the day charting. Little, hacks like that can make your day a little bit more streamlined because we're all looking for
Mhm.
ways to get out on time. And then, the other thing is, again, making that time to connect with your peers and colleagues. If you're consistently finding an issue that just doesn't work for you, look at those around you who are doing it in a more successful fashion, and we can borrow from each other.
Now, as you reflect on your attending journey thus far, is there anything that you wish you could have done differently?
I don't think so. I think I've done things the way I have for a reason because I'm really trying to find what works for me, and almost every year or two that can kind of change, and I welcome that. I think that's really refreshing. So I wouldn't change anything. I think I'm opening my mind a little bit more
Right.
to what's possible.
And during training, did they give you any instruction in terms of the different practice environments an obstetrician gynecologist can practice in? Or do you feel like you had to experience these practices on your own first and make career transitions and find one that fits you best?
Sure. So I think it's more of the latter. I think a lot of residency programs don't give a lot of guidance to, what private practice could be like, what the, corporate models could entail. A lot of residents don't have knowledge about, contract negotiation, how to use an employment attorney, things of that
Mhm.
nature. So it is a little bit, trial and error. And for me, that's okay. I think we can do a little bit better for our young trainees in terms of preparing them a little bit more.
Another thing that you mentioned in your article was that tension between determining what you're willing to tolerate versus something that you won't accept. So tell us a little bit more about that. Maybe give an example or a story and how you would navigate that tension.
Sure. So when it comes to, the care of a patient, whether it's, a medication, monitoring their progress in labor, their post-op course, something that could really go wrong really fast, I find that it's better for me to really have as many details as I can to take better care of the patient. So if you're getting report from, your colleague during turnover or a nurse is calling you with an update, that's where I really want as much information as possible if I'm not there, or I'll just see the patient myself. And I think, that's really important so that you get the best clinical picture. In terms of what you could let slide or you could let tolerate, general things that aren't, for me at least, not tied to the direct care of the patient. So, you know, I can't think of a good example, but sometimes there's, meetings and things like
Mhm.
that, that if you can't be there because you're in office hours, that's okay, like I'd rather be involved in patient care than some of those things.
We're talking to Roshni Patel. She's an obstetrician gynecologist. Today's Kevin MD article is 8 Things I Learned in My First Year as an Attending. Roshni, as always, will end with some of your take home messages that you want to share with the Kevin MD audience.
Sure. So I think the message that I really want to leave is, communication, know what you want and talk to the peers around you and talk to the professionals that are handling it well and maybe not so well. And I think in opening up some of these avenues we can do better, have better lives as physicians, and take better care of our patients.
Roshni, thank you so much for sharing your stories, time,
Thank
and
you.
insight. And thanks again for coming on the show.
Thank you very much.